When you're in treatment or the individual's in treatment, um, you definitely want to explore hereditary factors. You're going to want to examine with the individual questions, surveys, however you decide to move forward in your clinical practice or as a counselor. But you want to think about if an individual is more at risk for certain addiction and substance use issues. And when I say that, I mean hereditary, someone in their family, and again, back to culture, think about their communities. If an individual is surrounded and the cultural norm is to engage in substance abuse and addiction or any sort of abuse, any sort of substance use at all, you'll have that conversation during the interview or the initial intake. Okay, and then treatment can include individual therapy, group therapy, self-help, and psychiatric medications. So when we're thinking about dual diagnosis co-occurring, again, there's all different types of therapy, as you know, as counselor educators, but this is the take-home message. In order to be effective, both the disability and substance abuse related and addictive disorder must be treated simultaneously, because what happens is we focus on the primary disability and then we forget about substance use, or we're working with someone with a substance use and addiction issue and not addressing anything that's happening with perhaps their traumatic brain injury or their spinal cord injury or their CP or whatever mental health condition. So you need to have those conversations with our client and really help them to feel supported that there's definitely ways to treat both and to move forward. Also, just take into consideration there may be impaired cognition. Often that happens with using the drug of choice. It depends on the drug of choice, but also the disability. So that can make it a little more difficult, because if the individual doesn't have the awareness, and again, I'll use an example of perhaps you're providing CBT. Well, typically CBT, there's a lot of homework. No, well, not a lot, but there's some homework assignments. Or you may be using mindfulness. Remember that if you're working with someone with a disability that's experiencing any sort of delusional exasperations or any sort of perhaps TBI, spinal cord injury, or pain. If they're in pain, it's really hard to think properly. So you have to think about cognition, and then also intellectual disabilities, which is a whole nother population that I haven't really spoken too much about, but definitely another area to consider.